Hello everyone and welcome back to Banana Life. Today, we're going to talk about an important health topic that affects millions of people worldwide: diabetes. This condition has become increasingly prevalent over the years, and understanding it can help us take better care of our health or support those around us who are living with it. So, let's dive into what diabetes is, how it develops, its different types, symptoms, risk factors, complications, and how it can be managed and prevented. Diabetes is a chronic condition that affects how your body turns food into energy. Normally, your body breaks down most of the food you eat into sugar, glucose, and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin is a hormone that acts like a key to let the blood sugar into your body's cells for use as energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems such as heart disease, vision loss, and kidney disease. There are several types of diabetes: type 1, type 2, gestational diabetes, and other less common forms. Each type has different causes and treatment methods. Type 1 diabetes is thought to be an autoimmune condition. This means your immune system attacks and destroys the insulin-producing beta cells in the pancreas. The exact cause of this autoimmune reaction is not entirely understood, but it's believed to involve a combination of genetic and environmental factors. People with type 1 diabetes need to take insulin every day to stay alive. Currently, no one knows how to prevent type 1 diabetes. It usually appears in children, adolescents, or young adults, but it can also occur in older adults. Type 2 diabetes is the most common form of diabetes. It develops over many years and is usually diagnosed in adults, but more and more children, teens, and young adults are also developing it. In type 2 diabetes, your body doesn't use insulin well and can't keep blood sugar at normal levels. This is also known as insulin resistance. At first, the pancreas makes extra insulin to make up for it, but over time, it can't keep up and can't make enough insulin to keep blood sugar at normal levels. Lifestyle factors, such as being overweight or inactive, significantly increase the risk of developing type 2 diabetes, but genetics also play a role. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you've had gestational diabetes, you have a greater chance of developing type 2 diabetes later in life. Sometimes diabetes diagnosed during pregnancy is actually type 2 diabetes. There are also other, less common types of diabetes, including monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis-related diabetes. Understanding the symptoms of diabetes is crucial for early detection and management. Common symptoms include increased thirst and urination, extreme fatigue, blurred vision, and unexplained weight loss. In type 1 diabetes, symptoms can develop quickly, over weeks or even days. In type 2 diabetes, symptoms often develop more slowly over several years and can be so mild that they are not noticed. Some people have no symptoms at all and don't find out they have the disease until they have diabetes-related health problems, such as heart disease, vision problems, or kidney disease. Risk factors for diabetes vary by type. Risk factors for type 1 diabetes aren't as well understood but may include family history and environmental factors, such as exposure to viral illnesses. Type 2 diabetes risk factors include being overweight, having a sedentary lifestyle, being over 45 years old, having a family history of diabetes, and having high blood pressure or abnormal cholesterol levels. Gestational diabetes risk factors include being over 25 years old, being overweight before pregnancy, having a family history of diabetes, and having had gestational diabetes in a previous pregnancy. The complications of diabetes can be severe and affect many parts of the body. Long-term complications of diabetes develop gradually and can be disabling or even life-threatening. Some of the potential complications include cardiovascular disease, nerve damage, neuropathy, kidney damage, nephropathy, eye damage, retinopathy, foot damage, skin conditions, hearing impairment, and Alzheimer's disease. Managing blood sugar levels is crucial to prevent or delay these complications. Management of diabetes involves a combination of lifestyle changes and, in some cases, medication or insulin therapy. For all types of diabetes, maintaining a healthy diet is important. This typically includes eating a variety of foods, including vegetables, whole grains, fruits, non-fat dairy products, beans, lean meats, poultry, and fish. Limiting foods that are high in sugar and fat is also important. Regular physical activity is essential for managing diabetes and overall health. It helps control blood sugar levels, aids weight loss, and improves heart health. Monitoring blood sugar levels is another key aspect of managing diabetes. This can be done through regular testing at home with a blood glucose meter. In addition to lifestyle changes, medication may be necessary for some people with diabetes. Several classes of medications are available to help manage blood sugar levels. Insulin therapy is crucial for people with type 1 diabetes and may be necessary for some people with type 2 diabetes. Oral medications and non-insulin injectables are also available for managing type 2 diabetes. It's important to work with a healthcare provider to find the right medication regimen. Preventing type 2 diabetes can often be achieved through lifestyle changes. Maintaining a healthy weight, engaging in regular physical activity, and eating a balanced diet can significantly reduce the risk. For people with prediabetes, losing a small amount of weight and getting regular physical activity can lower the risk of developing type 2 diabetes by more than half. Some medications may also be used to reduce the risk of type 2 diabetes in people with prediabetes. In conclusion, diabetes is a complex and chronic condition that requires ongoing management and care. Understanding the different types of diabetes, recognizing the symptoms, being aware of the risk factors, and knowing how to manage and prevent the condition are all crucial steps in taking control of your health. Whether you are living with diabetes or supporting someone who is knowledge and lifestyle changes can make a significant difference. Thank you for joining me on this deep dive into diabetes. Remember, you have the power to take control of your health and make positive changes. Thanks for tuning into Banana Life and take care.